What if everything you thought you knew about health insurance was a lie? What if the one thing we believe protects us from financial disaster actually pushes millions into bankruptcy every single year? Imagine paying premiums for years, doing everything right, and still watching medical bills ruin your life. That's not rare, that's reality. And today, we're going to uncover the hidden truth your insurer doesn't want you to see. Before we dive in, hit like, subscribe, and turn on notifications, because this could change the way you think about healthcare forever. Health insurance is marketed to us as a safety net, something that steps in when life hits us with sickness, accidents, surgeries, or emergencies. You pay monthly, you follow the rules, you get coverage when it matters. That's the promise. That's the story we all believe. It sounds simple. You trade predictable monthly payments for protection against unpredictable medical costs. But here's the question. Does it actually protect you when it counts? Because according to studies and financial data, something astonishing shows up again and again. Nearly 3/4 of all medical bankruptcies happen to people who had health insurance. That means most people who go bankrupt from medical bills were insured, not uninsured, not careless, not reckless. They did everything they were supposed to do. Here's where it gets controversial. When you need care, you file a claim with your insurance company. That's just how it's supposed to work, right? But in reality, submitting a claim is only the first step in a battle you might not win. Your claim gets denied. The procedure is not medically necessary. The billing code is unapproved. You're told you saw the wrong specialist. These are real reasons insurers give, and you'd be shocked how often this happens. Let's break it down. Some insurers deny up to 1 in 3 claims, even when the care was in-network and recommended by a doctor. Even with in-network providers, legitimate claims get rejected. You might think, well, I'll just appeal. But here's the ugly truth. Less than 1% of appeals succeed. That means most people never get the coverage they were promised because the system is too hard to fight. It's not incompetence, it's a built-in feature of the system. Here's one of the most frustrating things people rarely talk about. Most insurance plans have something called an out-of-pocket maximum, the most you're supposed to pay in a year before insurance covers everything. Sounds fair, but here's the catch. If you get sick in October, hit your maximum by December, and then continue treatment into January, your out-of-pocket expenses reset.